Hello, hi, it's Dr. Erica. Hi, everyone. Thank you for joining me on this particular video. I will be talking about risk factors, causes, and symptoms of the heart failure or heart attack. Now, this particular video is not all inclusive. It's just a general overview because this topic it can be very, very much so in um, detailed and very specific depending on the individual as well that is involved and the underlying conditions. So do take notes. Please like, share, and subscribe as well. And again, I'm Dr. Erica, pharmacist. I've been a pharmacist for close to 10 years now. I'm the owner and founder of Millennium Pharmacy, and this channel is a platform for that business of mine. And I would like you to also visit that website. Okay, so I'm going to just give some general overview information, then I'll come with another video about medications that are used in general for heart failure, ventricular failure, as well, systolic and diastolic dysfunction. I'll do another video series as well following this particular one, but this one is going to just give an overview again. So there are 4 classifications of symptoms, and they are developed and they are in a algorithm or guideline from the American Heart Association, the American Cardiology College of Cardiology, as well as Heart Failure Society of America. They've all come together to collaborate and decide on a classification system for these symptoms and patient cardiac disease, things like that. So the first category says that a patient has cardiac disease and they can perform duties, they can perform their daily routine normally without any type of stress, without any type of fatigue or dyspnea, shortness of breath, also without any fluttering of the heart. Now, category 1, again, says that a patient has cardiac disease, but they're without any type of inability, and they don't feel any type of symptoms when they're doing their daily work. Okay, and by daily work, that means they're at home, normal routine, getting dressed, brushing their teeth, getting groomed, preparing breakfast, lunch, dinner throughout the day, cleaning the house, things like that. If they're able to do those things without any inability, without any symptoms, then they are considered category 1. But they do still have cardiac disease. Okay. Now, the second classification is going to be that the patient does have cardiac disease and they do have some or small slight limits to their daily capabilities, just slightly, and they do experience some sort of dyspnea, some sort of chest pain, some sort of discomfort slightly when they're performing their daily duties. And thirdly, classification number 3 is that the patient has cardiac disease with marked limits and they only feel comfort when they're at rest only. So they do have cardiac disease and they have marked limits going through their daily routine. There's only so many things that they can do out of a daily normal routine. And they experience chest pain or shortness of breath when they do those small daily activities because of the cardiac disease. Okay, so the 4th classification is that the patient has cardiac disease, the inability to carry out physical daily functioning, and they do have some discomfort. Okay, so they have the inability to carry out daily functioning. They cannot perform daily functioning by themselves, and also they experience discomfort when they do the little bit that they could do. Okay, so those are the 4 classifications of heart failure symptoms based upon the guidelines and officials who have put that information out. Okay, now 70% of patients who have cardiac disease also have coronary artery disease. Again, 70% of patients who have cardiac disease also have coronary artery disease. Now, 10 to 50% of patients who have cardiac disease also have afibrillation. 10 to 50% have afibrillation or afib. That's fluttering of the heart due to some sort of abnormality. Okay, now the wear and tear on the heart can be volume overload, it can be angina or chest pain, it can be myocardial infarction previously or heart attack. It could be a pulmonary infection as well. Those are items, again, that cause a wear and tear on a cardiac diseased heart. I'll go over those again. Heart attack previously or myocardial infarction, chest pain or heart pain, also pulmonary infection, as well as afibrillation, which is going to be 10 to 50% of cardiac disease patients. Okay, now to continue on with this video, 2 causes of systolic dysfunction or decreased contractility is going to be enlarged ventricles of the heart, low muscle mass, pressure overload, volume overload as well, pulmonary hypertension, also valve stenosis or shunts and high output, also having valves that are weak, which is also called valve stenosis. Okay, also for patients who are dealing with diastolic dysfunction, pericarditis, tricuspid valve weakening, that's the valve between the aorta and the ventricle, and also having a myocardial infarction or heart attack, also having enlarged ventricles as well. Those are the causes of diastolic dysfunction. I'll go over those again. Causes of diastolic. Diastolic means the heart is resting. When the heart is resting, there's a dysfunction. And because there's a dysfunction, there's underlying causes, which could be pericarditis or inflammation of the lining of the heart. Also, tricuspid valve weakening. Also myocardial disease, and also enlarged ventricles. Okay, so there's 2 types, two types of ejection fraction. Left ventricular ejection fraction is reduced, impaired, systolic, preserved left ventricular systolic functioning with presumed diastolic dysfunctioning. Okay, now, also, there's reduced myocardial contract and abnormal ventricular filling as well. Again, I'll go over this one more time to make sure that it's clear and understandable. So there's 2 types of diastolic dysfunctioning, and that's when the heart's resting. There's left ventricular ejection fraction being reduced, impaired, systolic, that's when the heart is contracting. Now, if it's contracting and there's an impairment, that's different from diastolic dysfunctioning. Okay, there's also preserved left ventricular systolic functioning. So a patient who has diastolic dysfunctioning may also have systolic preserved left ventricular systolic functioning. So if they're likely to have a diastolic dysfunctioning, they're also likely going to have a left ventricular preserved, though, systolic functioning. Meaning preserved, meaning they may experience it or might be preserved for another event, and they are presumed with diastolic dysfunctioning. And that is in patients who are female, patients who are obese, also those who are elderly, and those who are diabetic, hypertension or high blood pressure, afibrillation, or previous heart attack or MI. Okay, so those particular patients that fall into that category, again, are obese patients, hypertensive patients, female patients, are AFib patients, also those who have a previous myocardial infarction, and those who are elderly. So these patients may also experience reduced myocardial contraction and abnormal ventricular filling. Okay, so they may have reduced myocardial contraction and abnormal ventricular filling. Okay, so they may, that's a dysfunction in the contraction as well as the resting. The heart pumping, there's a dysfunction, and the heart resting, there's a dysfunction. Okay, so there are some modifiable risks and some unmodifiable risk. So those patients who are unmodifiable risk are those who are African Americans, those who are females, and those who are elderly, and those who are hypertensive. Okay, so the modifiable risk are those who are uncontrollable hypertension, with even with medications, also associated with heart failure, also those who are smokers, those who have kidney disease 1 through 4, and also those who have coronary heart disease. Again, so modifiable risk are those who have uncontrolled hypertension, coronary heart disease, also those who have tobacco use, and those who have kidney disease 1 through 4. Okay, so that's the conclusion of this video. I've gone over risk. I've gone over some of the types of heart failure, also risk, non-modifiable and modifiable, and also the I've gone over the classification, the description of the actual classes of symptoms. Okay, so that covers this particular video series, for the first video of the heart failure series. And please look out for more videos to come. Thank you for joining me for this particular video. Like, share, and subscribe. And again, I'm Dr. Erica, pharmacist. Thank you for joining me. Have a great day. Bye-bye.